Now, the WHO gave some very grim statistics, I think, last year and beginning of this year, indicating that 1.9 million Kenyans are either suffering in one mental issue or the other. Where are we at as of 2022?
Let me give you the statistics that I know that we have local studies that have been investigating the current state of mental health in this republic. And like I said earlier, the numbers we have are these. Number one, we have 1% of our population suffering from a condition known as psychosis. Psychosis is what you are describing, and I apologize for using this word, madness. Number two, of the patients who are accessing services in our healthcare facilities, both private and government, 25% of all outpatients and 40% of all inpatients have one or another mental health condition. Number three, according to the Global Health Observatory study by the World Health Organization, 10.8% of the Kenyan population has one mental health condition or another. Let me give it to you in numbers. 10.8% of our population, if we use the average population of 50 million, we are looking at 5.4 million individuals who are suffering, and they are not, they have one or another diagnosable condition.
4.4.
5.4 million.
5.4.
Yes.
Million.
Yes.
That's quite a population. Why do you think this is happening in this day and age?
Okay. You know, mental illnesses by their very means have what we call social determinants that cause people to get ill. Let me give you the statistics. Number one, unemployment. A third of our population, live below the poverty line. That is less than $1 per day per family. Number two, unemployment. 40% of the youth population in this country is unemployed. We have the highest unemployment numbers in East Africa. That leads to a lot of depression and a lot of anxiety. Number three, we have gender-based violence issues, like is reported in the media from time to time. And this has been leading to a lot of acrimony in families, and that sustained friction causes the people involved to get mental health conditions. Number four, we have a lot of trauma that people are enduring because of the things like, let me mention the 2007-2008 post-election violence. Do you know that 62% of the displaced people during that period developed post-traumatic stress disorder? Gambling. I have said over and over again that we have a gambling epidemic in this republic, and the gambling operators have refused to assist their users because their users are going into depression because of the mounting debt that they accrue. And last and finally, we need not forget that we are living in the era of the COVID-19 pandemic. COVID-19 escalated mental health conditions to obscene numbers, and that is why we are seeing such a high prevalence of mental ill health amongst our population.